HHTV, you may begin.
Welcome. Welcome to our audience around King County and at Horizon House, and guests for our webinar, Health Through Housing. The webinar is sponsored by two committees of Horizon House residents, the State Tax and Economy Committee and the Diversity Awareness Committee, and delighted to have the chairs of both of those committees here to ask questions at the end. And it's also sponsored by the League of Women Voters of Seattle-King County. We're especially happy to be able to share this information throughout the county through your presence here and your promotion of the program. And it's because it's a countywide program and affects just about everybody. I'm Peter Shapiro, your host. I'm delighted to be your host today. We all know how COVID has changed our lives in so many ways. We all experience that. And COVID required a major change in how we safely shelter our large homeless population. Traditional large shelters with many people sleeping in the same space were dangerous and would be dangerous breeding grounds for COVID. Fortunately, along with the problem that I just mentioned about homeless shelters, came a solution because hotel vacancy had plummeted as tourism and business travel virtually disappeared. No pun intended, virtually disappeared. Fortunately, King County and the state legislature then developed a plan, a very bold plan, to fund the purchase of hotels capable of housing up to 1,600 of our most vulnerable homeless population. That initiative is known as Health Through Housing, this title of this webinar. And I'm pleased to welcome, especially now, our two speakers, Representative Nicole Macri, who will describe the legislative creation of the funding source and the background for it, and Noah Fay, who is Director of Housing at the Downtown Emergency Service Center, or DESC, who will describe getting the program up and running. It's a new program. Not all the hotels are operating, and you get a chance to hear what's happening at the very beginning of the implementation. So with that, I will introduce Nicole, and then she will, in turn, when she's finished with her portion of the presentation, will introduce Noah. Many of us, of course, all of us here at Horizon House know Nicole very well as our representative, and we are so fortunate to be represented by her in Olympia. She's first elected to the State House in 2016, and she quickly became a legislative leader in housing justice, healthcare access, and protections for renters. She serves as vice chair of the Appropriations Committee, and also she's on the Healthcare and Wellness Committee, and a member of the Legislative LGBTQ Caucus. Outside the legislature, Nicole is Deputy Director of the Downtown Emergency Center, DESC, which provides housing, shelter-integrated mental health, addiction treatment, and other social services. It has recently launched the operation of temporary supportive housing sites acquired as part of the Health Through Housing initiative. Seattle Magazine named Nicole one of Seattle's most influential people in 2019, and the Seattle Met Magazine did that in 2021. I'm just wondering, Nicole, did you take a couple of days off in 2020? I can't believe that. Congratulations on those awards. They're so well deserved. She's honored to have received the 2018 Friend of Housing Award from the Washington State Housing Finance Commission, which is the big presence in the funding of homeless housing, low-income housing, and so on. So that commission gave her that award. And the magazine of the National Alliance on Mental Illness named Nicole a behavioral health champion last year. congratulations on all that, and so good to have you with us, Nicole. And it's your turn. And HH panelists, please just go on, take your pictures off.
Peter, thank you so much. It's such an honor to be here back at Horizon House once again to talk about some pressing issues in our community. And this is an exciting one, and I'm really glad to be able to share the stage, the virtual stage here with a longtime friend and colleague of mine, Noah Fay, who's led efforts at DESC, particularly in our housing and shelter programs for the last many years. So I wanted to give a little bit of background about the Health Through Housing program, which is a countywide program in King County. And if I can ask, my colleague Shannon is here, if you could bring up the slides. I just want to give some background on Health Through Housing. And before I talk about the specifics of the Health Through Housing program, wanted to talk about a little bit about the legislative authority and how it came to be. So the story begins back in 2015. In 2015, we had a divided legislature, meaning that the Democrats had a majority in the House and Republicans a majority in the Senate. And it was a pretty contentious session, and it was a session when there was great debate over the state's budget. To settle some of that debate, there was a bill related to cultural access, so allowing local communities to put to the voters an opportunity to increase sales tax for increasing access to arts and culture programs. And as part of the negotiations, that bill was expanded to include that authority for a sales tax increase, not only an opportunity to for voters to vote on expanding access to arts and culture programs, but also a sales tax authority to expand access to housing, affordable housing for low-income people, and behavioral health services. So that bill was signed into law in 2015, and we saw a very small number of communities take action on that. There was an opportunity for counties to take action, and if they didn't do it in a certain amount of time, for cities to take action. And in the period from when it passed in around 2018, 2019, two communities, Olympia and Ellensburg, both passed housing funds using that new sales tax authority. Our county, King County, had looked at the opportunity to put this on the ballot, but hesitated in part because of other big initiatives that were on the ballot in that era, or really considering the cost and time to put on a campaign related to this. So we really got input in the legislature. So in 2015, I was not in the legislature. I joined in 2017, but I was advocating for this bill and worked hard to get it passed. Fast forward to the 2017 legislative session, we still were a divided legislature. And I worked hard with colleagues of mine, including Representative Joan McBride, who was a legislator from the Kirkland area who's since retired, on giving local governments what's known as councilmanic authority, or allowing the councils, the elected officials, to take action on implementing this sales tax. And we heard from many local governments around the state that that would really make it a much more expeditious and effective process to expand housing funds in their areas. And we worked on that bill unsuccessfully for a number of years. And in 2020, State Representative Beth Dolio from the Olympia area took the lead on this bill. in part because her home community, Olympia, had passed this initiative at the ballot, but she was hearing from other cities in her district that they also wanted the ability to do this, but running a ballot measure would present challenges. So in 2020, we successfully passed the bill to change the taxing authority from vote of the people to elected officials being able to have that authority to enact that. Also in 2020, we got hit with a global pandemic. And so we ended our legislative session on March the 12th of 2020. And I came back home to King County, and it was clear that the world really had shifted. So as we look towards how we got to the Health Through Housing initiative, the story really does involve DESC, and Noah will talk a bit about that. But I will say that we partnered at DESC very closely with the county to really change how we were doing emergency shelter for all the reasons that Peter already described, because doing dormitory style shelter was just no longer tenable in an era of a respiratory virus that could be deadly to people, particularly for people who are older or had compounding medical conditions. And our experience at DESC in operating a hotel-based shelter in partnership with the county really inspired our county executive, Dow Constantine, to offer an initiative as part of his 2020 budget proposal, which came out in the fall of 2020, to enact a new sales tax revenue. So as you see here on this slide, the goal of that initiative was really to take a regional approach to address chronic homelessness, and to partner with local governments across the county to secure hotels or other single room dwellings to create up to 1,600 emergency housing opportunities, with the opportunity to convert those over time to permanent supportive housing units for people experiencing chronic homelessness. If you go to the next slide, please. So just to recap, the Sales Tax Authority allowed local governments to enact a 1/10 of a cent sales tax. It gave the ability to build or purchase housing, and then to operate, use resources from that fund to also operate those acquired or built buildings as emergency or permanent supportive housing. And the legislature provided that taxing authority to counties, and if counties did not take it up, to local governments. In King County, we had a number of cities who opted to pass the tax at a local level, and they are not included in sort of the broad tax that King County currently collects from this, but they are working on their own city-specific housing strategies. But because the county took a county-wide approach, the majority of the county is included in that. City of Seattle residents are included in the county-wide tax. They really took a county-wide approach on how to site these Health Through Housing sites. So we currently have 10 locations around King County that have been purchased, mostly hotels, but in some cases they were small apartment buildings. And about half of those are in Seattle. We have 5 sites in Seattle. 2 of those are operated by DESC. Noah will talk a bit about that. And then the other ones are located in cities all around the county, including Auburn, Federal Way, Kirkland, Renton, and Redmond. And the Health Through Housing initiative is really tailored to people who have the greatest barriers to housing stability, people living with disabilities. So then, as the name implies, is for people who need health supports, who struggle with their health, and for whom we know that housing is the primary intervention that will bring them health and wellness. And so it's not just housing. It really is about providing a robust array of on-site support services to people who are living in the emergency housing, and hopefully future permanent supportive housing. And with that, I'm going to turn it over to Noah to talk a little bit about about DESC and the DESC experience.
Yeah, thank you so much, Nicole, and thank you, Peter and Horizon House committees for the invitation today. We love talking about our work, so I'm thrilled to have the opportunity to do this today. What I'm going to talk about is one example of the type of programming Nicole just discussed was possible by virtue of this Health Through Housing initiative, and this is going to be DSC's Mary Pilgrim Inn emergency housing program. I think it's first important, though, to couch a little bit about who DESC is, and then I'll tell the story of how this program arrived into existence. So it sounds like many of you might be familiar with DESC as an organization, so some of the conversations you've had, but I think it's important to cover a bit of our suite of services, and most importantly, our orientation towards the work we do. So DSC as an organization was founded back in the late 70s, 1979, as a response to an observation that clearly the highest needs people were somehow not getting into existing shelter programming in our community. Upon further exploration, it appeared what was going on was that people were not able to access programs because for any number of reasons, the barriers to entry were just too high. So some people weren't able to make it into available shelter programs because they weren't able to show up on time, or they were required to be sober, and that was just a bridge too far for some people, or people were required to pay and they couldn't afford. And what we found, what was happening was that tended to mean that the people with the greatest needs, the longest histories of homelessness, and some of the most severe challenges in their lives were the very people who were being left out of services. And so as an organization, DSC's founding mission has been to design programming that meets that population's need, to find and develop, or to develop programming and build out resources that specifically focus on people who existing resources don't work for any number of reasons. So for what cracks exist in our social service net, of which there are many, a lot of people fall through, we want to be in a position where we're able to catch people who fall through those cracks by designing services that really tailor to the needs of the most vulnerable people in our community. We've been doing that ever since. We started as an emergency shelter downtown on 3rd and James, the old Morrison Hotel. I'll talk a lot about that in coming slides. That was our original programming service, and from there we've grown quite a bit. We do work really spanning the entire county these days. We are concentrated mostly in the city of Seattle, but we have resources available to people countywide that range from behavioral health services, so outpatient services for people struggling with mental health and substance use issues, to 24/7 crisis intervention services that span the entire county. So somebody who is in a crisis, usually tied to a mental health issue or a drug use issue or any number of other situations in their life, historically have had few resources other than police or emergency room interventions. And DSC's tried to close that gap and fill that crack, as I mentioned earlier, that people fall through by providing 24-hour-a-day crisis response services tailored to meet the needs of people with major behavioral health issues. We do street outreach where we try to bring services to people. So we don't expect people to inherently come to us, we go to them. And so we do outreach services all across the county, trying to draw people into services by building trust and relationships that historically have been broken for a lot of the people we're looking to serve. And we also run a supported employment program to help people not just look for work, but have the necessary supports to be successful in that search. There often are many barriers to people getting back into the employment market, and we try to help address those to help people be successful. And then really my kind of core bucket of work at DSC are these last two bullets here you see on the screen. And that is shelter and emergency housing services, which is what we're going to talk actually almost exclusively about today. But it's our original programming, and it's one that has been most heavily influenced by the Health Through Housing initiative. But also want to highlight that we know full well that the solution to homelessness is not shelter, it's housing. And so our real focus in my department is bringing as many permanent supportive housing resources online, of which we have almost 1,500. It says over 1,400. I think we're being bashful. We have almost 1,500 units of supportive housing around the community. And that's a unique type of housing where not only is it permanently affordable for people, there are embedded supports in the program, meaning staff and other resources to help people be successful in housing and stay housed, as many of the people we are looking to serve at DSC have a great number of challenges in doing that. And we see it as our job to do whatever it takes to help people be successful. So I just did a laundry list of resources. It is equally important to highlight the philosophy we use to deploy those resources. And it starts with this basic assumption that housing is a basic human right. It is not something that we see as inherently something people need to earn or demonstrate that they deserve. It is something everybody, by virtue of being a citizen of our global community, deserves. That's not how housing works in our community, as we all likely know, but we reject the premise that it needs to be something that people need to earn, and rather something that needs to be prioritized first. And that's because the whole inherent belief at the organization is that once we remove the chaos of homelessness, by giving people a stable platform of a safe place to live, it is then more reasonable and realistic that all of the other social stabilization, clinical challenges in someone's life are able to actually be addressed. Without providing that support, the likelihood that somebody's able to address the challenges in their life goes way down. And so we want to make housing the first thing we offer people, not the thing they get after they demonstrate readiness or otherwise engagement with programming while still experiencing homelessness. We do all that while prioritizing the people who need it the most first. So DSC clients really are people who are living with some pretty profound challenges. It's not uncommon for people we work with to have been experiencing homelessness for decades. There are a number of people that come to mind immediately who had never had a place to live before they moved into DSC services. So all of our supports really are aimed at people whose needs are so great that if we don't design the services with them in mind, they're unlikely to be successful. So we're talking about a population with pretty severe challenges who for existing social service systems have not been very effective. If you go to the next slide, Jim. This whole model is referred to as the housing first approach. I'm really proud, I think, of DSC's role in making housing first a bit more of a household term and a familiar term. That's not always been the case when we think about delivering services to people experiencing homelessness. That's what this chart here is meant to highlight. The traditional approach that you see here on the screen really tries to demonstrate that our old model was about people having multiple different stations and steps that they needed to overcome in order to be deemed housing ready and offered a place to live. So it wasn't uncommon years ago, and it's still not entirely uncommon in our community for somebody who's actively experiencing homelessness to have to meet a fairly high bar to access shelter placements. I think that might resonate as we hear some of the conversations in our community about people who turn down shelter. I think that story often gets oversimplified, and when at further exploration, the reason why people turn down shelter is often people have to give up things that are near and dear to them, or they have to meet certain expectations that they aren't able to meet for any number of reasons that are often quite valid. But let's say in the good old bad days, somebody was able to access shelter. Well, then in shelter, what would happen is they would work with some sort of case management, or they would do it on their own to try to find a transitional housing resource, which was quite popular for quite a long period of time, where the idea was that during somebody's stay in a transitional housing program, which was usually a pretty rule-heavy environment, they would, quote unquote, fix whatever issue caused them to fall into homelessness in the first place, hence being deemed housing ready, and then offered a permanent place to live. That process was complicated. A lot of people weren't able to overcome all of those hurdles, particularly people with some of the greatest needs. So we've shifted to the model that you see on your screen called the housing first approach, where what we do is we find people experiencing homelessness and we prioritize the highest needs people and try to get them into housing, particularly permanent housing, as fast as possible. Really cutting out the middleman here. And that's something that's proven to be remarkably effective. Go to the next slide. That all said, shelter plays an enormous role in our system still. The housing first approach not only is about having very few barriers to housing, but it's also the idea is to get people into housing as fast as possible. And that is dramatically hindered by the lack of affordable housing in our community, particularly for people at the lowest end of the income spectrum, and particularly for people with major behavioral health issues like the people DSC serves. So we've always tried to get people inside into temporary arrangements like shelter. So the picture you see here on the screen is a picture of our old original program we called it the main shelter. It was the program I referenced earlier at the Morrison Hotel on 3rd and James. Our goal was to get as many people in with as few barriers as possible, meaning we had a lot of people in a fairly small space. The idea being that if people were left outside overnight, that's inherently an imminent life-threatening event for basically everybody. Not having access to a place to safely shelter is potentially so dangerous that we want to maximize how many people we got into the space. That's where I got my start at DSC. Nicole did too. I have super fond and profound affinity for what the thousands of lives that I feel confident to say that main shelter saved over the 41 years we were operating that program. However, that picture I think really highlights just how difficult that space likely is for people to be. You can see the gap between those bunk beds is a couple inches at best. It's a crowded space. And with that came a lot of stress. With that came a lot of challenges with people trying to navigate just their day-to-day basic needs, but people were inside, and that was our goal. Fast forward from this model in 1979 all the way to late March, early April of 2020, when we are in the midst of the pandemic and the governor and the CDC and our public health entities issue an order that says everybody needs to do a bunch of things. The two most prominent were stay home and socially distance. And those two things were fundamentally impossible for the people we were serving in that program that you see here with the bunk beds, meaning we realized we needed to take drastic action if we wanted to keep our clients safe. And so we worked with our partners at King County to basically close that shelter program overnight and move 238 people to the Renton Red Line, to a hotel where people either had their own room or they shared a room with a roommate. The idea was to prevent the spread of COVID and complications associated with it. But if you move to the next slide, we saw that it not only did that, it did a world of other amazing things for the clients we were serving there. So almost overnight, I think I'm understating it. Literally overnight, in several cases, staff in that program reported to me, again, despite doing this rapidly in the midst of a pandemic with unbelievable stress and unknowns, staff reported that there were clients that we had known who had been using our shelter programming for years, decades in some cases, who appeared to look like different people nearly overnight. The term unrecognizable was used in a pretty justifiable way quite a bit about people that we just were shocked to see how the ability to have a private space, to sleep on their own schedule, shower with privacy, plan their own meals, just transformed almost immediately. None of this should be surprising to us, given our commitment to housing first, and that being the whole premise of our work is that we need to give people a private, stable place to be first if we expect people to be able to make change and heal and recover. I will say I was shocked by how fast it happened, though. That really was a shock for us, which meant we decided that we can't justifiably go back to that old model. There's no way when this pandemic ends, and naively of me at the time, I thought it would be a few months before we'd have to think about that. We had a lot more time than that. But we told our King County partners, and they agreed, to their infinite credit, that we're not going back to the old congregate model of doing this work. What you see here on the screen was something that we were able to do while we stayed at the Renton Red Line, was partner with the University of Washington to actually see, is it really just our own anecdotal response or anecdotal observations to how people are doing, or are people actually doing better in this model? And the results were overwhelmingly, my goodness, yes. So they did a study, both of a DSC program at the Red Line, plus a couple others run by other organizations in the area, where people reported just greater feelings of stability and cited specifically having a consistent private space to be. People reported better feelings of overall mental and physical health, a better sense of well-being. We saw a dramatic reduction in conflict and crisis, meaning we were not needing to lean on emergency 911 calls, which was something that the Old Main Shelter did frequently, I think, which speaks to the space constraints in that old congregate crowded program. The thing that really struck out to me was that people reported that they had time to think and plan out their future, whereas before, what they spent their day doing was figuring out where they were going to get their next meal, where they're going to store their stuff in a crowded, difficult environment. Having this space allowed people to future plan in a way the old physical space simply did not. My absolute favorite anecdote about what this looked like for people was within a few weeks of the move, and organically, staff had nothing to do with this, a jogging group popped up amongst people staying at the Renton Red Lion. I don't think I can express with words enough how unheard of that would have been in the old congregate main shelter model. But it just speaks to when people are given time and afforded space, they plan for their health and their well-being in a way that they just can't in this old model. Go to the next slide. So as this new model kind of took shape and we were designing it on the fly, we worked with King County through the Health Through Housing program to try to identify permanent replacements for the old main shelter model and design a new program that we're calling supportive emergency housing. So this is to replace the old shelter model, is I think a fair way of thinking about it. It's not permanent housing, but it is the replacement for the old congregate crowded shelter model. The idea is to provide a low barrier service for people, a low barrier, and by low barrier, I mean people aren't required to meet with case management. People aren't required to agree to be sober. People are required to participate in services as much as at the pace that they can tolerate. And then we offer people amenities, and then we staff the program in such a way that we have a whole bunch of resources 24 hours a day for people, where our staff are obligated to do really assertive engagement with the people staying in the program in an effort to draw them into services. The fundamental point of the case management and the services we have on site is to try to help people find a permanent housing resource. Given the complexities that our clients are invariably dealing with, that looks like a lot of different things. It's not just looking for housing. It's often connecting with primary care, connecting with behavioral health care, trying to reconnect with family, looking for work, applying for benefits. So it's a really kind of holistic wraparound service that the staff on site provide to everybody who's staying in the program. People don't sign a lease, but they are welcome to stay until they find a long-term solution to meet their needs. So it's this kind of in-between model where the idea is we want people to have a place they can know is theirs for as long as they need it, while constantly looking for a permanent space to exit homelessness entirely. We also have the ability, which is really nice in these programs, to take referrals from the local community, the general geographic area around these programs, which is not always the case. So it's been a nice resource for people living unsheltered in the North Seattle area and local encampments. I think I glossed right over the actual location of this. So it is in North Seattle. It is a former Holiday Inn that the county purchased in June of 2021. DSC started operations in October of 2021. So we are almost at a full year. We opened on Halloween. So we're not superstitious people around here, and opened up on Halloween, and have found the program to be remarkably successful since. Highlighting further what these services look like, I mentioned the housing focused case management, but we also provide on-site meals and transportation through a partnership with Harborview, which is really wonderful. It's a long-standing partnership that we have had. It actually goes back to those old congregate shelter days that I've been talking about. We have embedded medical care in the program, not just nursing care, but on-site primary medical care and prescribers to be able to work with people who often what we find have long histories of complex medical conditions that they've been doing their best to manage while living unsheltered, which is just wholly nearly impossible for a lot of people. And once they're able to have a stable place like they do at the Mary Pilgrim Inn, they're able to engage in medical care in a way that was just simply not possible, meaning people have a better chance to recover than we were offering them before. And that's a critical component of our programming. Our population is older and inherently often coming with more complex issues, which are compounded by having been living on the streets for a really long time. So embedded primary care, medical care has been critical for us for decades. It's actually the namesake of the program. The program is named after Mary Pilgrim, who is alive and well. People often ask that. She is a nurse who worked in our old main shelter program for years upon years. I was lucky enough to work with her directly in my days working in the shelter. It was a really inspiring nurse who worked with people in a really tough environment. We wanted to honor her work by naming this program after her. Next slide, please. I think I'm going to throw back to Nicole to talk a little bit about how you can get involved in some of this work and advocate for how this can better impact the community. So Nicole.
Thank you, Noah. I always feel so inspired when you talk about that, that just evolution and that story of that transformation and how much we learned at DESC as an organization. And, I think really inherent in that is our close partnership with King County and how our lessons at DESC are really getting amplified in the health through housing approaches across the county as other programs are being stood up. I can't present on these huge victories and the progress that we've made without talking about how it happens. And it really happens because of strong advocacy, and want to put a plug in for how you can get involved. So we've shared King County's story, but the taxing authority granted by the state legislature has also been accessed by numerous communities around the state. And all of our largest communities in Washington implemented this housing fund. It was a bill that passed in 2020 called House Bill 1590. And I am aware of some of those: Snohomish County, Clark County, where Vancouver is located, Whatcom County, City of Bellingham, City of Tacoma, City of Spokane, and other places around the state have enacted these housing funds. Now, King County is the only one I know that has been squarely focused on and using this investment to address chronic homelessness specifically. So address homelessness for people who are living with serious disabling conditions, who've been homeless the longest in our county and who have the greatest barriers to housing stability. So as I mentioned, my journey on this started long before I was in the legislature in 2015, advocating for that bill that included arts access and housing access. There's right now opportunities to advocate at the local level with our city and county councils. They are considering our local city and county budgets and making key decisions about how much resource is dedicated to affordable housing, and specifically to housing opportunities for people who are currently homeless, and emergency responses like shelter funding and outreach funding for people who are currently homeless. And so there are two organizations that I wanted to point you to consider looking at and signing up for their action alerts and to get involved in advocacy. For local action on the city and state budget, we are putting a big push on homeless service workers, and by extension, human service workers in our city and our region, having the ability to make a living wage. what we have seen through the pandemic is that there are worker challenges across multiple sectors in the private sector, nonprofit, and public sector. But we know that there have been chronic underinvestments in social services, specifically in homelessness services, for many, many years. And this is coming back now in ways that are particularly challenging. And what we find is one of the things that really stops us from moving more quickly in opening up many of these sites is that we don't have the workforce that we once had. And a lot of that has to do with the challenges around how low the wages are. So there is active advocacy happening now to City Council around this. And our partner, the Seattle-King County Coalition on Homelessness, has been leading a lot of this effort. So I encourage you to go to their website, which is homelessinfo.org. And similarly, the state legislative session is around the corner. Don't I know it? And we work closely with our partner, the Washington Low-Income Housing Alliance, on the agenda that they'll bring forward to increase investments in addressing homelessness, expanding access to affordable housing. And they have, in the last year, worked very closely with me on also putting an emphasis on ensuring that workers in this sector are well supported. This is a people helping people endeavor. And what we have found is that the workers in this sector have weathered a tremendous amount during the pandemic. And it's now our turn in government to make sure that they are well supported. And your advocacy on that would be extremely helpful. So you can find out about the Housing Alliance advocacy updates by going to their website, which is WLIH.org. If you go to the next slide, I just wanted to run through, for those of you who have not done outreach to your elected officials before, although I know Horizon House residents in particular are pretty well seasoned at reaching out to their elected officials. I know that from personal experience. But these are just a few tips about how to craft an effective advocacy message. It's as simple as introducing yourself, identifying that you are a constituent of an elected official, and really starting with the values of why you care about this issue. Then talk about the challenges that we have. What is the problem? As this says, for example, we have a shortage of affordable housing that meets the needs of people who are homeless and people living with behavioral health disabilities. And then state the solution. We need more local investment. We need more state investment in the things that we know work, like supportive housing, and not only in building that, but in operating it and supporting the workers we know are needed to support people who are transitioning from homelessness to permanent housing. And then always be clear with an ask, saying, will you support an increase in the budget to support workers who are doing this difficult work? Or as this says, will you vote yes on House Bill 1590, which was the authorizing legislation for the Health Through Housing Initiative, et cetera. So I just wanted to make sure we touch on the essential piece of what makes this happen, which is just individual advocacy to local and state officials on this. And next slide. And then finally, we wanted to make sure that you reach out to us at DESC directly for more information if you would like it. We have designed a little follow-up survey so you could give us feedback about today's session and to directly send some questions to us about the work that we do or questions that you have about homelessness and housing in our region. So you can see the link here on the screen. You can also use your smartphone camera feature to link to it using the QR code on your screen. So it's just bit.ly/DESC survey. And we hope you'll take a minute to do that. And with that, I think we'll turn it back to Peter for questions from folks who are here with us live in the Zoom room.
Oh my gosh. Nicole and Noah, thank you. My goodness. I've been in this racket for a long time. Well, it's not a racket. I've been doing this kind of work as a volunteer for a long time. And I learn something new every time I speak to people like Nicole and Noah and all their wonderful colleagues. So I do have a couple of questions in the chat, and I'm going to try to be even-handed. I'll start now with Sally Wren. Sally, you can put your picture on if you wish and ask your question.
Nicole, my question is, how can we get more publicity in the paper on this about the positive results, but especially about the monetary results, which really hits for voters? Because I know that the costs of the ER, when you don't have the housing necessary, is much greater than it is by having people housed. So can you address that? I think Dub may have done a survey, but who's done the finance end of this, please?
Yeah, so there have been a number of evaluations across the country, and Noah may have more to add on this, but DESC actually was involved in one of the most landmark studies related to the housing first approach and permanent supportive housing cost effectiveness about a decade ago, when we partnered with the University of Washington to look at one of our housing first buildings, the 1811 Eastlake building, and really compare the costs of two things. First, the public services costs for people in the 12 months before they moved in the building and the 12 months after they moved in the building. And then to look at a group of similarly situated folks who did not have the opportunity to access housing first opportunities in the way that the tenants in the 1811 Eastlake building did. And what we found was that, as you say, dramatic cost offsets, or a dramatic difference in the amount of public services that people use. Housing is the difference. Housing is what brings health and well-being to people and reduces their use, particularly of emergency services. So we are constantly promoting that. When we talk to media, we find that media in particular is really now looking at sort of the controversies and the sensationalism related to homelessness. Has become a very polarized issue in our community for reasons that are understandable as the issues have grown. And I, as a policymaker, have really been promoting the cost effectiveness of adding more specifically permanent supportive housing to address homelessness in our community. That will be the thing. The more supply of supportive housing we have, the less it will cost us over time to address homelessness. And I just want to turn over to Noah because he may have more to add here.
Yeah, thank you, Nicole. It's a great question. I mean, that 1811 study is probably one of the most well-known. And I think definitely it's reasonable to point to as kind of a linchpin to the housing first movement. That said, that sort of cost effectiveness, cost savings, cost offset, however you want to frame it, has shown to be a trend in building after building after building. So there's a lot of research outside of Seattle, in Seattle, that speaks to that. And one of our sister organizations has done some research on the cost comparison. So one night in permanent supportive housing, one night in the ER is the same as 1 year in supportive housing, and 3 weeks in a jail, 3.5 weeks in the jail is the same as a year in permanent supportive housing. So the way we've historically tried to manage some of these issues proven to be horribly cost ineffective. And so finding a housing solution for people with some of these greatest needs is proven to be huge cost savings. It's also clearly the more humane thing to do, if you ask most of people around DESC. The other thing that has come up too is around this model shifts. We've seen a pretty significant, and I alluded to it, reduction in 911 calls to the program. And so it's a better utilization it's a better utilization of that service. There's definitely cost savings to be had there too. So this new model affords the same sort of kind of PSH, permanent supportive housing, I should say, I'm sorry, use trade vernacular, that you see at 1811, you are seeing in these emergency housing programs too. I would actually build on that just super briefly too. I do think sometimes what gets lost in the media narrative that Nicole talked about with the controversy is the people we are supporting still have really major needs. And so people are undeniably better served, are far more likely to engage in care and have a better long-term trajectory moving into a program like Mary Pilgrim Inn or 1811 East Lake. It doesn't mean somebody's mental health issue goes away. So I think it's important to highlight that success doesn't mean that people aren't necessarily still dealing with crisis systems, sometimes still needing added level of help. However, they're just doing it far less than they were doing it in these old congregate settings or living on the street. And I think that gets lost in the media narrative, unfortunately.
Oh, great question, Sally. You unearthed a whole bunch of information with that question. I'm now going to turn to a question from Chris in the chat, then Jean Durning, who has her hand up, will be next. And then Stacy, stay with us. I have your question. It's a great question, and you be the fourth one. So from Chris, if one encounters an individual in need of services, how do you suggest they seek assistance?
Yeah, I'm happy to field that one. I still recommend these days calling 211. I do honestly think that is the most effective way for people to understand in real time what resources are available to them. Our entire community has moved away from individual kind of referrals to programs. Basically, it's a long story to get into the details on that. So 211 will be able to refer people to immediately available resources. The question about how people get into housing is now managed centrally across our community through something called Coordinated Entry for All. And it's a process where people are basically promoted based on vulnerability and then referred out to available resources, which is by far and away more efficient system than old school kind of applying individually to individual programs. There's still some details as a community we're trying to get right. And I don't think we're there yet entirely, but we're doing some work on that. So it is important to know that that is the kind of entry point for housing resources in our community. But short-term, immediate, I need help tonight, 211. Oh, Peter, I think you're on mute.
Of course. I'm polite and then I forget to turn it back on. So Jean, you're next. And if you like your picture on, that'll be great. But go ahead with your question. Jean Durning.
My computer says that I can't start my video because you have stopped it.
Okay, well, let me.
My question, though, has to do with the supported part of what you're talking about. Who make up your staff? Some of them probably peers who have graduated out of homelessness themselves. But what are your requirements? How do you find people? And yes, of course, we need to increase their pay to something livable, but are there major challenges to even get anybody into doing this work?
Yeah, Jean, that's a wonderful question. I feel like Nicole and I both can actually talk about that from maybe different angles. People. So yes, to your question, do people come to this work if they personally have some lived experience of the systems that are out there or experiencing homelessness? That's often, frequently, something that our staff bring to the work. Some people have gone to school to be social workers or studied psychology or sociology, and they want to do some direct service work. Other people like me were in a college course, and I volunteered because I had to as part of a college course 22 years ago, and fell in love with the work and never left. So there's a lot of different pathways. I think what I tell people is we are constantly looking for new people to come do this work. This work is something that I think is, this topic we know is something that is one of the more critical or the most top of mind topics amongst people in our local area. And if people are interested in this issue and like to work with people and are committed to meeting people where they're at and using a non-judgmental approach to work with people, we can likely find a job for you and we'll train you. That is truly a path for a lot of people. I think workforce issues writ large. So definitely we need to pay people more. We need to pay people like the professionals that they become doing this work or they are upon entry into this work. That all said, it is hard. This is hard work. And with the job market the way it is right now, there are jobs that I think it's reasonable to say don't have the same sort of take-home stress that our job does, that you could get and get paid the same. And that's just a reality we're fighting against. And so workforce stuff has never been harder, to be perfectly frank. I've never had this much difficulty recruiting people into the work. So we're always trying to get creative.
Yeah, I think, Noah, you said it well. And so we've really been focused on that. It's a wage issue, but it's also around the providing support to people because the work is difficult. Even if you are paid adequately, the work has just become more difficult. The pandemic has both exacerbated the behavioral health conditions that people had. That's in part because of isolation. It's because of a reduction in access to other kinds of services that people have historically been able to get in the community. So everything from, food banks to clothing closets, to all sorts of services are less available now than they were a few years ago. And then our emergency services are also stressed with their workforce. So our crisis responders, our law enforcement entities, EMTs, they are all also seeing struggles. And so our staff are dealing with more acute issues. But I think, Jean, as you say, this can be a very attractive profession, including for people who have life experiences related to homelessness or related to living with the behavioral health condition, having recovered from a substance use condition, or who live with a serious mental illness that's well managed, where they can do this work. And we have lots and lots of colleagues at DESC who have those real life experiences, and they add tremendous value to the work that we do.
Great question, Jean. Great answers, Nicole and Noah. This is super. I'm going to turn now to Stacy's question. It's actually a very excellent question with many subparts. I'll try to do it justice by breaking it down into smaller bites. And since I don't see anybody else with a hand up yet, we might be able to get through it all. So Stacy asks or says, looks like these changes are starting to work. People want to stay in the communities they have family, friends, or services in. Why is there such a delay on opening the additional hotels, 6 or 8 purchased in King County for housing? And then she adds, couldn't parking for those living in RVs and cars be granted on site to allow connections to services for the people who are residing in the hotels?
Yeah, those are good questions. I think we always feel like, why does everything take so long? People are in such great need. Can't we mobilize quicker? And then on the flip side, I think we remember, oh my goodness, we're moving faster than ever. Like our county's ability to purchase 10 buildings in less than 12 months is amazing. And they have been doing multiple things, including working with local governments to get support for those buildings. There definitely has been some opposition in some locations of the county, and just a need for a lot of education about what the county's vision is, and a lot of the elements that Noah talked about having 24-hour staff on site, around making sure that when clients have challenges, as he said, a lot of folks are residents. Many of the challenges they have in their life just don't disappear once they're in housing, but can be managed with the right kinds of supports. doing education with neighbors about that is essential. So that slowed down some of the opening. The biggest thing I think has been this workforce challenge. So we've had a lot of our partners step up, our nonprofit colleagues step up to take on these different buildings. Some of them for the first time doing projects at this scale. I mean, DESC is experienced. We operate over 1,500 apartments of permanent supportive housing in the region, but some smaller organizations are really looking to scale up dramatically. Chief Seattle Club, the Urban League, and others. And so I think that's been part of the challenge, but it makes a big difference to have these smaller organizations, particularly ones focused on serving communities of color, brought into the fold in doing this work. And so while the sensational headlines might be, why is it taking so long? I think it's also important to remember at the same time, it's taking less time than ever before. But we're constantly pushing to do things quicker. And part of, like at DESC and in my policymaker role, but Noah as well in his leadership role at DESC, part of our job is like to push to go as quickly as possible. So the Mary Pilgrim Inn, which Noah highlighted, was the first of the How Through Housing sites in the county to open. We really challenged ourselves to mobilize quickly, relocate a number of clients who had been staying in other locations and relocate staff, hire up staff, new staff into the program. And there's just so many times we can do that and be like, yay, we did it. Now on to the next one. And we subsequently opened a second site also in North Seattle. And so operating over 200 units, 230-ish units in the north end of Seattle, which has just been tremendous. But it takes time to put all those pieces in place.
Oh, good, great. I'm going to go back to Chris for a moment before I finish with the question, the multi-part question that came from Stacy. And Chris basically has a suggestion. How about making, this is in terms of contacting, as I understand, contacting the people who need help. What about making a question about one's housing part of the screening process in emergency rooms?
It's a great,
go ahead, Noah.
Yeah, it's a great suggestion. And I think it's one that largely happens, at least in many emergency rooms, where there have been different iterations over the few years since this coordinated entry process I referenced earlier, the system by which people get prioritized and then referred out to housing, where the idea is there to be many access points where that screening can be done for people, including in ERs. Pandemic has made that trickier. There's actually a move happening now to move away from having people having to complete a screening tool as the key to getting on the list, if you will, for resources in our community, but rather using data that people don't have to self-select into, but rather gets pulled by how often people access things like emergency rooms or other resources in the community. We're not quite there yet, but the goal there is to avoid people having to seek out the service that they need, but rather the service come to them. So I'm optimistic that'll be more of a reality in the coming years.
I'm going to go back to the question and the multi-part question by Stacy and then Ginny. And the question from Stacy continues, and this is really, I think, a plea to have another webinar, because it goes into the larger question of lack of affordable housing. So much funding, Stacy writes, for years have been designated. We also see some cities and developers only build for those in the 80% average income. Highest need is those just above Section 8 income, or 25% to 55% average income. As daily more in this group are evicted and become homeless as they are priced out of homes. So take a short crack at that, guys, and then I'll turn to Ginny.
Quickly. That is true. That the challenge, the need for housing is actually greatest for the most extremely low income people. I think Stacy makes a good point that for people who don't qualify for Section 8, there's not really an option for them. So for those who do qualify for a Section 8, there's just a scarcity there's far more people who need housing subsidy than it exists. The stat I always like to use is that the people we serve at DESC, for the most part, are on disability income, supplemental security income. Often that is about a little over $850 a month. And so you can find essentially 0 apartments in our region for that amount. In fact, the kind of the fair market rent for a studio apartment in the Seattle area is currently over $1,800 a month. So the gap is really big for people who are at the lowest income. So if you can get a housing subsidy, a voucher, a Section 8 voucher, that's gold. But for those who are extremely low income and they can't even afford an apartment if they have their full income, or even 2 people on SSI in a studio apartment at their full income won't cover it. I want to commend Executive Constantine, because the legislation he transmitted and the King County Council, the legislation that they passed, really said that the sales tax dollars need to be used for people below 30% area median income, for people who are experiencing homelessness. But there is a lot more that we need to do. And with my state legislative hat, I will say we are really looking at a full range of options, because the housing crisis is not, while it's hitting the most extremely low income people the worst, it's not just hitting those folks. And you bring up a really important point, that there are gaps where there's really no supports for people, and those folks in the 25 to 55% of area median income are a very important one for us to address. There are some programs, including the low-income housing tax credit program at the federal level, but we need a lot more investment in housing for people below 50% area median income.
Bravo, and remember those tips for advocacy. Make your voices heard. And by the way, you say, well, Nicole does all these things, I don't need to write to her. I think, Nicole, correct me if I'm wrong, the more you get from constituents about what the need is, the more you can point that to other legislators. And that's a very effective way to do advocacy. And now, so Ginny, you're on.
So my comments and questions relate to what Peter has just mentioned. Nicole, it's so wonderful to be represented by such an effective legislature. Thank you for all the work you do on our behalf. And to Nicole and Noah, I just want to say this afternoon's presentation has given such a message of hope. But I'm wondering, what sustains the two of you? What gives you the stamina and perseverance to keep working at the level that you do? And what can we do to help maintain that for you? Because you are really doing an incredible service for us.
Thank you so much for that question, Ginny. I will say, for me, it's like, when Noah and I talk about this quite a lot, actually, it's like the mission brings us to the work. For me, the mission of DESC to improve the health and well-being of people, particularly people who've been impacted by mental illness and substance use, long histories of homelessness, is just incredibly compelling. I think it goes back to my earliest days, and my mom and my grandmother really driving home this point that we all need a safe place. We all need a place to call home. What keeps me sustained in the work is really the folks who I get to work with, both at DESC and in the legislature, just to know that there are others who are interested not just in the compassion related to the work, but interested in the problem solving, the endless creativity that it requires, the sort of challenging the status quo and the kind of thrill of victory when you are able to shift the status quo from something that harms people to something that helps people. So some of it is the drive to succeed, and just getting to work with people who have such varied life experiences. I can't imagine working in any other sector of work.
Yeah, I mean, Nicole and I often answer this question in a very similar way. So, you know, I would say all of that really rings true for me. I always think about how proud I am that this works, and it works for people who often many aspects of society have given up on. And so you combine those two things, that's really inspiring. I mean, I've had the privilege of being here for a long, long time. And so I've gotten to see people change over decades in a way that I think is really profound and probably hidden to your average person in our community. But it's something that really keeps me going. Is I see people that I knew in my younger days living in our old shelter who are now housed and have relationships with their family, and you know, in ways that just were not seemingly impossible years ago, and I know they're not when we design services like this. So it keeps me going to try to build more of it, have more of it, because I know it works, and then being inspired by seeing how it works for the people we're currently serving really keeps me going.
Noah and Representative Macri, you are true heroes. You are champions. You are majestic and phenomenal. And you know what? I think there are many, many, many others doing this kind of work in your organization at DESC and around our area who deserve that same accolade, even though we don't know directly what they are doing. And we need to help them as much as we can. I'm going to now just say, for those people who are at Horizon House watching on HHTV 370, spread the word to your friends if you think there's value in this webinar. It'll be rebroadcast a week from today in the evening, October 19 at 7:30 on HHTV channel 370. Thank you very, very much, panelists, both the professionals and our wonderful residents and people in the audience suggesting questions. You have made and provided a very, very enriching experience.